It's there, right? Okay. All right, doctor. Now I'm sharing the screen and then we can go ahead.
Okay.
Right.
For scrolling across the slides, I'll have to tell you.
Yeah, you can tell me. You can start now, doctor.
Yeah. Very good afternoon. I am Dr. Bhavana Girish. I'm a reproductive medicine consultant at Motherhood Hospitals, Indiranagar and Banchankri. Today's topic of discussion is going to be about male infertility, the evaluation and the treatment. Next slide, Beres.
Yes, doctor. One.
So, we'll be discussing this topic under these headings: the background or the basics of fertility in men, prevalence of male infertility, the causes, the diagnosis, what is the basic tests that we have as well as the advanced tests, and how to go about in the treatment. Next slide. So, coming to the very first, that is understanding the basics. Now, I know that this is something that a lot of men unfortunately don't know, and it's something that we all need to know. The basic of how our body works, especially the reproductive physiology. So, when it comes to male fertility, let us look at the reproductive organs. What is their function and what is the role in the production of the sperms? That is the main reproductive gamete of men. So, let me just get my pointer. Yeah. Now, the testis is the primary reproductive organ. This is the site of production of the sperms. Sperms are produced in the testis starting from the time of puberty. This gets stored in the epididymis, which is an organ present on the head of the testis. From the epididymis, at the time of ejaculation, the sperms travel in a liquid called as the semen through the ejaculatory duct or the vas deferens. It goes via an organ called as the prostate out through the penis and leaves through the urethra during the process of ejaculation. Next slide. So how does a sperm individually look? Now, a sperm is one of the smallest cells that the human body can produce. If you look at it under a very high power microscope, it looks something like a little tadpole. So what it has is a head, a neck, a midpiece, and a tail. The head is containing the nucleus that is going to code for the genetic material of the baby. The tail is what helps the sperm move in a forward direction. The middle piece contains the mitochondria that gives energy for the sperm to move forward. And the acrosome or the tip of the head has a structure which helps it fertilize with the egg and fuse with the egg to form the embryo. Next slide. So when we talk about male subfertility or infertility, what I have seen in a lot of couples coming to me is they come under the impression that fertility is more of a woman's problem. But we need to understand that prevalence of infertility overall is increasing, and specifically male fertility problems are increasing much, much more higher than women also at this point. If we look at infertility overall in our country, we understand that fertility problems are much higher in the South Indian states, Kerala, Tamil Nadu, Telangana, and Karnataka. And more or less, the upper middle class population are the ones who are suffering from this condition. As high as about 20% of all people do suffer from fertility problems in today's day and age. Coming to the male factor itself, next slide, Meryl. So when we look at what is the percentage of men having the fertility issue in a couple, it is more or less a rule of 30 or a rule of 33, equal to the female population. And in 33% of the couples, both men and women, that is both the husband and the wife, are having some sort of a fertility issue, which is contributing to a problem in getting pregnant. Next. So what could the causes be? Now, when we look at the causes, it can start from a reduced volume of the semen, a reduced mobility or a reduced power, a reduced count. Apart from this, the sperm can be absolutely healthy, but there may be an obstruction in the genital tract, the tract that we talked about that leads to the exit of the sperms from the testis into the ejaculate. There can be a structural defect in the sperm leading to many morphologically, genetically abnormal sperms, which again will not cause fertilization. And an increasing subset of our couples are facing erection and ejaculation problems. Now, this comes under a broad category of sexual dysfunction, and this I specifically want to address because this is something that couples are not hesitant to come forward with. If you dig deeper, this is actually resulting in a lot of marital discord, friction between the husband and the wife, and also fertility problems. So, erectile dysfunction and ejaculatory problems are not something that should be ignored or should be brushed under the carpet. This is an extremely common condition, and if you are facing it, there are treatments for this ranging from psychological to medical to surgical. So please come forward and get it addressed. Next. So what could the causes of a low sperm count, motility, or morphology be? Now, the production of sperms is actually regulated from the level of the brain. The brain secretes some hormones which are going to act on the testes, stimulate it to produce the sperms. And therefore, if there is a problem at any level of this axis, you may have a difficulty in the problem in the sperm production. This can be reduction of the pituitary stimulating hormones, genetic causes, testicular descent failure, infections, torsion, varicocele, drugs and radiation induced damage, heat related damage to the testes. At the level of the sperm transport, it can be due to infections, vasectomy, or a congenital absence of the vas. At the level of the ejaculation, it could be a problem with the erectile dysfunction, prostate surgery, nerve related problems, and due to some medications that they may be taking, specifically steroids, testosterone. Medications for chronic illnesses like diabetes and hypertension may also cause some degree of erectile dysfunction. Next. Yeah. So let us discuss one very, very underspoken about topic, the role of stress in male fertility. So I think in today's day and age, there is nobody who is free of stress. We all have a lot of stressors in our lives, work stress, personal life stress, emotional, mental, physical stress, responsibilities. Apart from this, you also have the lifestyle related stress factors, which cause due to a sedentary lifestyle, unhealthy diet, lack of exercise. All of these lead to something called as an oxidative stress damage in our body. So what happens is that there is an excess of oxidative free radicals or raw species being produced, like H2O2 hydroxyl and oxyl ions. This damages the sperm DNA, protein, lipid, and biomembrane. End result being an impaired sperm function and male infertility. Next. So how do we diagnose it? Now, when we look at a sperm sample under the slide, the primary analysis that we do is on a ejaculated semen sample. We identify immediately if there is a reduced sperm count, an abnormal looking sperm, or an abnormal motile sperm or an reduced sperm motility. Next. We need to also talk about the role of stress and sexual health. Why does stress negatively affect sex life? When we look at couples, there was a survey done in around, I think, 2020. In British adults, about 2,000 British adults had participated in this survey where they talked to couples and asked about what is the biggest factor which is negatively affecting their sexual intercourse or their sex life. 45% of the couples said it is due to stress. Most likely, it is a work related stress that they have. And at the end of a long workday, they are not able to have enough energy or enthusiasm to have a good sex life, which again negatively affects their fertility as well. Other issues included health factors, physical health, mental health issues, having a child already, work, pornography, social media. Again, this is something very interesting that we need to know. Because of the excessive overabundance of social media that we all have access to, people are no longer interested in sexual intercourse. Reality TV, friends, other family members all also play a role in this. Next. So once we've identified that there might be a problem, how do we go about diagnosing? Our most important test in our arsenal for identifying male factor infertility is to do a semen analysis. We generally encourage our patients to collect the semen sample in the hospital itself, or it has to be transported to the hospital within an hour of collection. The semen sample should be collected with an abstinence period of 2 to 3 days. Up to 5 days may be acceptable, but not more than 5 days. If the abstinence period is more, it also negatively impacts the sperm quality. The semen has to be collected in a clean container by masturbation or coitus interruptus. It should not be collected in a condom because condoms contain spermicizing substances which may damage the sperms and give us a false negative report. If we see a grossly abnormal sample, we repeat it after 4 weeks of treatment. Next. So what are the parameters we are looking for? The sperm volume should be more than 1.5 ml, should have a count of at least 15 million, and should have a motility of at least 32%, morphology of at least 4% normal forms. Next. If we are seeing any abnormality in the basic sperm analysis, we proceed to the second level investigation. This includes hormonal tests like FSH, testosterone, LH. A scrotal ultrasound or a Doppler of the scrotum may be done to see if there is a varicocele. And a sperm DNA fragmentation test may be recommended if the age of the male partner is above 35, if he is a smoker, a diabetic, or has a stress-related lifestyle. Next. Now, once we have identified the root cause, what are our management options? Next. So, first and foremost, I always tell all my patients to go for lifestyle changes. This may be just lifestyle changes alone, or maybe in combination with medical therapies. The male partner has to be encouraged to eat healthy food, home cooked, freshly prepared food, which is rich in vegetables and fruits. Quit smoking. Smoking is one of the biggest factors which damages the sperm DNA and is responsible for a reduced count and motility. So, smoking has to be completely stopped. While I understand that it may be difficult to abruptly stop, you may switch to less harmful options like nicotine patches or vapes. Slowly wean off it. At Motherhood Hospital, we also have a psychologist on board who can help you with these options and help you in taking care of this. Alcohol intake should be limited to at max once in about a month or once in 2 weeks. Regular physical activity is essential. Avoid keeping your laptop on your thighs while working or keeping your mobile in your pocket all the time. Keep it off your lap, use a desktop, and do not keep your mobile close to you when it is not necessary, like overnight. Get proper sleep. Next. What are the foods that are good in boosting the male fertility? All seeds, antioxidants, pumpkin seeds, walnuts, garlic is a very good antioxidant again, which helps to increase the sperm count. Maca roots, now this is not a native Indian product, but it is widely available in the market. tomatoes, dark chocolate, spinach, bananas, eggs, asparagus. These are all excellent foods to include in your diet. Apart from this, I also encourage a very holistic approach where you can take any Ayurvedic or Siddha medications. Ayurvedic medications known to boost the male fertility include ashwagandha and shilajit. Both of these, again, are prescribed by any Ayurvedic doctor, and they are very safe to be used even when we are doing our treatment. Any other form of medication also, which is natural therapy based, may be used along with our medications. Next. Now, sleep. This again is something which is very easily said, but not as easily followed, unfortunately, by most of us. We need to have a consistent bedtime, should ideally be before 11 p.m. in the night. Have a good bedtime ritual so that you're able to wind down and relax sufficiently before going to sleep. Sleep at a good, comfortable temperature. Use proper lighting, should be dim lit. Our mind is tuned to having darkness at night. This promotes the secretion of a hormone called as melatonin. Melatonin is essential in reproductive health, mental health, emotional health. Time meals and snacks appropriately. Keep the last meal of the day at least 2 hours before your bedtime, and preferably avoid any form of caffeine, coffee, tea, etc. post around 6 p.m. in the night. Next. Once we get past these natural treatment strategies, the other tools in our arsenal are hormonal treatment, mainly a drug called as clomiphene, surgical treatment if there is a varicocele, and last and final is assisted reproduction, which comes under our gambit. Next. So, what are the options for assisted reproduction in male infertility? Whenever we identify a couple with male factor infertility, the primary thing that we are looking for is the sperm count. If the count is at least 8 to 10 million and motility is reasonably good, then we can go for an IUI or an intrauterine insemination. What we do in an IUI is we give the wife, the female partner, oral and injectable medications, look at the egg growth. Once the egg is ready to be released or ovulate, the male partner provides a semen sample, which is processed in the lab and then inserted into the uterus. This is a fairly simple and straightforward procedure, does not require a lot of injections, does not require any hospital admission, and has good success rates in male factor infertility of about 20 to 25% per cycle. In case the count is less than 8 or 10 million, but it should at least be around 1 or 2 million per ml, our option is to go for IVF and ICSI or intracytoplasmic sperm injection. What we do in this is that the female partner is taking daily injections. She will undergo a surgical oocyte retrieval. The male partner will provide the semen sample. The egg is individually injected with a sperm in the ICSI procedure, and then the embryo transfer is done into the uterus. Next. Now, what are the options for couples where the sperm count is even lesser, less than 1 million, or it is completely absent, whereas it is called as azoospermia? Here, we have to go for surgical methods of sperm retrieval, where we can take sperms from the tubules in a procedure called as TISA, TZ, or micro-TZ. We can take it from the lumen in a procedure called as PISA. Both of these are done by the andrologist. At Motherhood Fertility, we have a panel of andrologists with whom we have detailed consultations, and we will come to a proper team, abridged couple-specific plan where we can tell you what is the best option for you, a TISA, PISA, or a TZ. And once the sperms are retrieved, we go for an ICSI or an IVF with that. Next. So I think in this, I have covered most of the basics of male factor fertility and all the options and the treatments that we have. If anybody has any questions, you can drop it in the chat box below, or these are my handles on social media and my mail. You can always drop a mail and I would be happy to answer them. Thank you.
Thank you so much, doctor. It was a pleasure having you today.
Thank you, Beryl.